have so many medical, and they are maybe aged, and their system is not as strong as the younger one. So we have to design the yoga as per the patient need. That is the concept of yoga therapy. So today I am going to talk on yoga therapy and its benefits in the medical field. So application of yogic methods for healing of diseases. It is simple. Why so much of stress has been given is it is simple. It is not expensive. It is scientific. It has preventive role as well. You need just a floor, a mat, and some knowledge about the basic yogic method. You don't need to be very thorough or expert in all complicated yoga, what we call as cultural yoga. We can do even simple yoga, which has a huge benefit on humanity. So as I was telling, it is simple, it is not expensive, it is scientific, it has a preventive role as well. And if you take the human body, the yoga talks about the physical body, astral body, and causal body. Or in a simple language, if you go through the writings 5,000 years back, they talk about the matter and soul. Our body is matter, and the soul and the matter lives on the soul. So it's like a Prakriti and Purusha concept. So if you take the asanas, and it helps to tone the nervous system. And what are the benefits of asanas? The overall general benefit of asanas. There are so many asanas which I will talk about it to you. It helps to tone the nervous system. It improves the circulation. It releases the tension. It improves the flexibility. So we need to be flexible. We need to be stress-free. Our circulation need to be ideal. It should not be going for any blockage or any irregular flow of blood to the different systems. And our neurological system should have a proper tone all the time. So always yoga is not a very stressful exercise. We should not contract the muscles too much, and we should not do very like a tight manner. Mind should be relaxed, body should be relaxed. So always perform yoga in a slow and relaxed manner. It broadens the mental faculties. It enhances spiritual capabilities. If you take the pranayama, the breathing exercise, I always feel that sometimes that we have two nostrils. We breathe through the nostril and we inflate the lung through these two holes, the nostril hole. But many times people have only one hole is functioning and one is maybe blocked or maybe partially blocked. So the lungs may not be getting the adequate oxygen. So we may be hyperventilating people without our knowledge. So it's very important that both nostrils should be properly open and our lungs should have a proper inflatory capacity. If you don't breathe enough, the lung will lose the tensility and we may be off breathing rather than fully breathing. The pranayama is deep breathing, helps to cleanse and nourish the physical body. While inhaling fully, we are supplying adequate oxygen to every cell in the body. It helps us to get physical and mental rejuvenation. So proper relaxation is very, very important for yoga. So by continuous work, by proper relaxation for yoga, and we need a proper relaxation throughout the day for a healthy body and healthy mind. By continuous work, the natural efficiency of the body and mind diminishes. We work a lot. We work from morning to night, continuously under stress sometimes. Some other profession, especially in medical profession, even though we enjoy doing it, we have a constant pressure, constant challenges. It applies to many other fields also. By continuous work, the natural efficiency of the body and mind diminishes. Rest and relaxation gives the body a chance to recharge. Yogic methods give this. So the Yoga Sutra, the father of Yoga Sutra is Patanjali. Patanjali is the father of Yoga Sutra, and he has written in detail about the different types of yoga. And what is sutra means? Like yoga is suturing the wounds of life. So it sutures. Our body is filled with wounds. Mind wound, body wound, organ. Different organs has different wound due to infections and stress and so many things. We have wound not seen outside. The body is filled with wounds. So Yoga Sutra is suturing the wounds of life. So breathing practices brings awareness. Breath is a bridge between the body and mind. Our body and mind is bridged by the breath. Increase the lung capacity, as I was telling. It increases the blood circulation because oxygenation also indirectly favors the good blood circulation. It relaxes the mind and neurological system. So the Surya Namaskar, I think many of you would are aware of Surya Namaskar. It is a salutation to sun, which is a combination of many asanas. It has pranayama into it, and if someone does Surya Namaskar in an ideal body fitness, if they are fit enough to do that, And because it has a combination of asana, some asana may be difficult at particularly, but there are people at even 70 years do all the components of Surya Namaskar. So it is a combination of the yogasana, and and apart from the yogasana, there are different aspects of yoga called pranayama, which I was telling initially, and mudras and bandhas. I will talk about mudra and bandha in the coming slides. So in the component of the Surya Namaskar is pranamasana, pada astasana, ashva sanchalasana, pada sanchalasana, sasangasana, sastanga namaskar, bhujangasana, parvatasana, sasangasana, ashva sanchalasana. You can go and search further about all these asanas, because my aim of topic is to talk on yoga therapy. So you can know how to do it and how to stand for this particular position. You can get some guidance and start doing it slowly. And pada astasana and pranamasana. These are different components of Surya Namaskar. So if you take the basic asanas, there are different types of asana, like standing asana. Some asana you can do in the standing position. Sitting asana, some asanas you can do in the sitting position. Pronasana and supinasana. But you have to keep in mind, elderly people are prone for fall, like Parkinson's disease. People have cardiovascular issues. There are some asana they can do in the sitting position. You can teach what asana they can do in the sitting position, and it can do even assisted asana. Some asana they can get some simple assistance, or they can do some component which is more easier for them to do rather than trying to do every component. So that you have to choose what kind of asana suit a particular person, like standing asana, sitting asana, pronasana or supinasana. The standing asana are, you just hear about this. I think many of you may know it actually. So I don't want to go and teach every basic asana. The concept, as I was telling, is different. Ardhakatti Sakarasana, Utkatasana, Tadasana, Ekapadasana, and Trikonasana. These are all standing asanas. You take the sitting asanas, Swatikasana, Virasana, Gomukasana, Ardha Matya Chandrasana. So just to know about all these names, these are all sitting asanas. Swatikasana is a commonly used asana. Virasana also not that difficult, you can do it. Then Pada Konasana, Janu Sirsasana. You take the prone asanas. Prone asanas, prone position and supine position. The asanas done in the prone position. Makarasana, Dhanurasana, Trayaka Bhujangasana, Saduranga Dandasana. Then supine asanas. The types are Navasana, Pavana Muktasana, Alasana, Chakrasana, Sedu Bandhasana. So we will come to the clinical part of the yoga and its application. So if you take the yoga management of diabetes mellitus, commonly you see diabetes in people with cardiovascular disorders, cerebrovascular disorders, neuropathy, so many. So basic diabetes produce so many disorders in different organs. Yoga is suited for both types of diabetes mellitus. In insulin-dependent diabetes mellitus, asana helps to prevent and increase in the insulin requirement. In NIDDM, non-insulin dependent diabetes mellitus patients, asana helps to normalize blood sugar due to the high intensity workout. So these are all scientific concepts. Then if you take regular yoga practice, it helps to increase the glucose utilization. It helps to attain ideal body weight. It develops stamina and provides a sense of well-being. The sun salutation, the Surya Namaskara, one round consists of 12 postures, which I was mentioned before. Asanas useful in diabetes mellitus, you can do all kind of asana, like standing asana, like Tadasana, Ardhakatti Sakarasana, Trikonasana. Sitting asanas like Dandasana, Vajrasana, Bada Konasana, Paschim Motanasana, Ustrasana, Gomukasana, Ardha Atyeshanasana, Janu Sirsasana. Pronasanas like abdomen lie down position like Makarasana, Bhujangasana, Salabhasana, and Dhanurasana. Supinasana I was telling, like Navasana, Matyasanasana, Supta Virasana, Sarvangasana, Alasana, and Savasana. So that is the classical thing that you use your fingers, and the right side of the eye and right side is called as face is called as Suryan, and the left side is called as Chandran. So the Surya Bedana and Chandra Bedana. So you inhale through the left, you close the right nostril, inhale through the left nostril, and close the left nostril, exhale through the right nostril. That is Surya Bedana. Then you close the left nostril, inhale through the right nostril, then close that and exhale through the left nostril. That is the Chandra Bedana. Keep in mind that you can do just like that. There are techniques where you have to hold it for some time, like 4:4:4, like that. And it's better to avoid in cardiovascular patients because it produces sympathetic and parasympathetic responses. So you can just do a breathe in and breathe out technique. And like in Nadiswati, that is more than enough for the beginners as well as for the people with underlying medical disorders. Then Surya Bedana, which I was telling to you. Then Bastrika. Bastrika is you have to outstretch both hands. And while taking the hand up above the head, you inhale. And while you are bringing down the hand down, you exhale. So it is a simple method. So inhale while raising the hand and exhale while bringing down the hand together. That is called Bastrika. And Brahmari is a kind of mudra as well as a breathing technique where you put your index finger on the forehead, middle finger on the nostril, and the ring finger on the upper lip, and little finger on the lower lip, and both thumb begin the ear lobule, close to the mastoid. Don't press the face, just touch the face, and don't press the eyeball. And that is called Sanmukhi Mudra. And while putting that mudra, you make a B sound like like that, like a bee noise. So that is called Brahmari, like making a bee like sound and using Sanmukhi Mudra is called Brahmari. It has a lot of medical benefits. So the mudra, if you take the fingers, the people, our body is made up of 5 elements. We are made of fire, air, sky, earth, and water. We know these 5 components makes our body. And the same component, they name the fingers also. Thumb is fire, index is air, middle finger is sky, and ring finger is earth, and little finger is water. So if you take the mudra, the different mudras are Chin Mudra, Pankaj Mudra, Apana Mudra, Varuna Mudra, Vayu Mudra, Linga Mudra, and Sangha Mudra. When you are doing pranayama or chanting meditation, and you can use this chanting meditation as just breathing and breathing out, that kind of pranayama, you can use your hand for mudra purpose. Chin Mudra, you can go through, I will show you Chin Mudra and Chinmaya Mudra and Adi Mudra, that is putting a thumb and making a closed fist. That is quite used for stress, underlying stress disorders. And Chin Mudra is used for Om chanting. Chin Mudra and Chin Mudra means to lock or close off. The energy flow to the particular area is locked. For example, you know that there are 7 chakras in the body. I don't want to go into very detailed lecture. And if you take the perineal region, and the bandha done is called Mula Bandha. And then you have Ujjaini Bandha in the abdomen region. Then you have Jalandhara Bandha, which is in the throat region. It has medical benefit. So when you are breathing in and a particular place, if you lock the air, that is called Bandha. So that means to lock or close off. Energy flow to the particular area is blocked. When Bandha is released, this causes energy to flow more strongly through the body with an increased pressure. So as I was telling, Mula Bandha, the pelvic floor muscles, people with pelvic weakness in the pelvic floor muscles, people have sphincter issues and all those things, the Mula Bandha is quite useful. So you have to make a contraction and hold the perineal region for some time, then you have to release. It's called Mula Bandha. And Uddiyana Bandha is abdominals up to the diaphragm. And they make a contraction and hold there for some time, then they relax. It's quite good for the muscles there as well as for the digestive system and other things. And Jalandhara Bandha is throat. When you are inhaling, then when the air goes to the throat region, you lock the throat and you just lock the air there and hold it for some time. It stretches the thyroid gland. It helps to improve the thyroid hormone secretion as per the writings, as per the things. And the Jalandhara Bandha, they say that it is quite useful for this thyroid issues. But you should know the technique you should do in here. You should not strain yourself. You have to slowly inhale, hold it for lock it for some time, then release it. Don't lock it for a long time, quite short time. So Yoga Nidra. Yoga Nidra is, I think all of us would have done. No? When you are tired, you just lie down flat and relax your body. That is Yoga Nidra. It's a special type of relaxation, also known as conscious sleep. It helps to eliminate the stress from the subconscious level. And meditation is Om meditation, Om chanting. And you can tell, depending upon the people, what belief they can do Om chant, Om meditation. And there is another thing called they can say also. They are also that like that. and they have to close the eyes and they have to meditate. This is called chanting meditation. The different types of meditation is there. Then there is another method called use the tip of the tongue and touch the middle of the palate and make a sound called ma. Maka is called makaram. Like that. That vibration goes through the pineal gland and pituitary gland to the brain and relaxes the brain. It helps to get some good sleep actually. So there are different types of meditation. What meditation I'm talking about is called chanting meditation. It's particularly useful in some psychosomatic and stress-related disorder. A lot of paper on these kind of meditations are useful in people with underlying stress disorders, because sometimes we give only medication, it makes them to sleep and it makes some chemical change, but the lifestyle modification and this kind of add-on therapies are very, very useful for holistic approach and holistic outcome. So articles, we'll come to the scientific articles, and in fact I have 2 or 3 papers with me which I'm planning to publish, and these are other articles people have published in Journal of Diabetic Research review article, open access by Kim E. Ines et al. Yoga for adults with type 2 diabetes. They have done a systematic review of controlled trials. Yoga practices may promote significant improvement in several indices of major importance in management of type 2 diabetes, including glycemic control, lipid levels, and body composition. These are all published articles. And it lower oxidative stress, lower blood pressure, enhance pulmonary and nervous system function, improve mood, sleep, and quality of life, and reduce medication use. So complementary therapies in medicine 2016 by Vinod Kumar et al. Role of yoga for patients with type 2 diabetes mellitus is systematic review and meta-analysis that highlights 17 randomized controlled trial were defined in the systematic review and meta-analysis. Meta-analysis showed yoga caused a significant reduction in the fasting blood sugar, postprandial blood sugar, and HbA1c. So what are the benefits for yoga for stroke patients? We see quite, as a neurologist, we see a lot of stroke patients. It improves the mind-body connection. It improves the balance, range of motion, and strength. It improves walking and balance. Accessible for all stroke patients. Reminds you to breathe while you exercise, because sometimes we'll stop breathing. I hyperventilate, as I was telling, there are 30% population of breathing disorder while sleeping. So it's very important to, it has a role on breathing disorders of sleep also. By doing regular pranayama, the incidence of all these things will come down. So it has a lot of benefits, yoga therapy for stroke. Especially I started using for my patients because many people cannot afford everyday physiotherapy, it's expensive for them. And this yoga has equal benefit, and they need a mat and they need somebody to supervise. Some yogas can be done in the sitting position itself. They can use the functioning hand for the exercise, the non-functioning hand or leg actually. So it has a lot of benefit, not only for stroke, a lot of other articles on different disorders, which I don't want to go through because of my time limitations. So there is a special chair available for yoga for stroke survivors. American Stroke Foundation is, and you can read about the yoga chair. People make it, and you can buy. There are people who buy that and use for doing yoga. Yoga interventions used for rehabilitation of stroke, Parkinson's disease, and multiple sclerosis by Jachari, Legal et al. There is an article people can read. Tadasana Yoga Maneuver for preventing vasovagal syncope recurrence. A pilot study. There's a pilot study available on the role of Tadasana. And I have some patients I done Tadasana in sitting position, not using the leg because they feel dizzy when they stand and do the Tadasana, and it has a benefit. And there is an article about using vasovagal syncope. So this is my talk on yoga therapy and its benefits. And I have done a 1-year course on yoga therapy, and I felt it's quite useful for integrating into the practice for patients' medical benefit. So thank you very much for listening to me. My talk is over, sir. So I have finished my talk, sir.